would like to show you the famous rules of two. Unfortunately, not all twos are that true, but nonetheless, it's important to remember those because most of the patients have these characteristics or they fit into this two rule. So, Meckels occurs in about 2% of the population, ranging from 0.1 to 3%, but about 2. It's 2 times more common in males. In general, it's 2 feet from the ileocecal valve, and also about 2 inches in length, but it has been up to 26 centimeters big. Usually, it's at 2 years old of age that it presents, but in my experience, I only have seen Meckels in adults. Well, I only treat adult patients and did endoscopy at the Children's Hospital of 2 of the university hospitals I worked, but I never saw a Meckels in a children at that time. So the 6 cases I have seen are in adults. And one of them was 62 years of age, but there is patients who are up to 80 years of age who can develop Meckels. There are 2 types of mucosa, native and ectopic, and the ectopic mucosa is gastric and pancreatic, and it's mentioned that about 2% are symptomatic. And here are all the symptoms that can happen in clinical presentations. The 2 most common ones are obstruction and bleeding. So these little pearls of the rule of 2 is quite useful, but as you know, all the rules have exceptions. Here you can see that patients who have Meckels can present with intussusception, with torsion of the diverticulum, strangulation, bleeding due to peptic ulceration because there is gastric mucosa there. There can be also tumor. There can be ectopic pancreatic tissue there as well, neoplastic transformation, and, as mentioned before, perforation. When there is incarceration in a hernia, that has a name. It's called Littrés hernia.